What is the difference between epilepsy aura and anxiety attacks? Imagine feeling a sudden wave of fear or strange sensations that catch you off guard. Sometimes it's hard to tell if it's a seizure warning or just a moment of anxiety. Understanding the difference can really help you manage your health better. An epilepsy aura is actually the first sign of a seizure, especially a focal seizure that starts in one part of the brain. It's not a separate condition but part of the seizure process. Auras can include unusual smells, tastes, visual changes, or feelings of fear and anxiety. They can also cause sensations like tingling, dizziness, or a sense that something is not right. These symptoms happen because of abnormal electrical activity in the brain. Usually, an aura lasts just a few seconds to a couple of minutes. For many people with epilepsy, an aura is like a warning sign that a full seizure might follow. After the aura, there might be loss of awareness, muscle jerking, or confusion. An anxiety attack, also called a panic attack, is a sudden rush of intense fear or worry that isn't caused by abnormal brain activity but by emotional or psychological triggers. Anyone can experience anxiety attacks, but they are more common in people with anxiety disorders. Symptoms include a racing heartbeat, sweating, trembling, shortness of breath, dizziness, and a feeling that something terrible is about to happen. These episodes tend to last longer than auras, often between 5 and 30 minutes. During an anxiety attack, you are usually fully aware of your surroundings and responsive, even if you feel overwhelmed. The main differences are in what causes them and how long they last. Auras are caused by abnormal electrical signals in the brain, making them a physical part of seizure activity. Anxiety attacks are triggered by emotional stress and do not involve abnormal brain activity. Auras are very brief, often just seconds to a few minutes, while anxiety attacks can last longer. During an aura, you might remain just partially aware but experience sensory changes that aren't typical in anxiety attacks. For example, you might smell something strange or see unusual visual patterns. Anxiety attacks usually involve a sense of impending doom but don't typically include sensory distortions like smells or tastes. It's also important to note that sometimes symptoms can overlap, especially if an aura involves feelings of fear or dread. This can make it tricky to tell them apart without medical help. If you have epilepsy, understanding these differences can help you recognize warning signs and seek proper treatment. Always consult a healthcare professional for an accurate diagnosis and personalized advice. Knowing what's happening in your body can make a big difference in managing your health and living well with epilepsy or anxiety.